You are watching The Wellness Hour, leader in medical news information. I'm Randy Alvarez. We have a special edition today. We're talking to Dr. Catharine Goodson. She's a dentist, and her company focuses and specializes on patient safety and what to do in a medical emergency. Catharine, welcome to the program.
Randy, thanks for having me.
I was thinking, should I call you Dr. Goodson or Catharine?
You can call me Catharine.
Okay, good. Now, for people that don't know about your company, Medical Emergency Mastery, you help dentists do what?
I help dentists and their staff, actually I teach dentists and their staff how to recognize and manage medical emergencies that can occur in their practice so they can best protect their patients' health and safety.
You know, anticipating this interview, did some research, and it's very interesting because I'm thinking, how big of a problem is a medical emergency in a dental office? And I guess the University of Texas did a study that in a 10-year period, and correct me if I'm wrong, but in a 10-year period, that a dentist will have 8, or at least in the survey, 8 emergencies in a 10-year period, and 150,000 dental medical emergencies every year. And by the way, so we can define this, and these are people that are calling 911, is that right?
Randy, that is a huge problem. That's absolutely correct.
Okay, and now this is, I think, the biggest part of it, because I asked around, knowing you're coming, you know, asked around, and some of my dental friends did know this was a big problem, but that in a 10-year period, a dentist will have 8 medical emergencies in 10 years, so almost 1 a year.
You know what's amazing about that? Those emergencies don't even include the ones that they're not reporting.
Okay.
So we're talking about emergencies.
So these are 911 calls?
Those are 911 calls.
Interesting.
We are not talking about the emergencies where the patients have transported themselves to the emergency room, the emergencies where family members have taken them, or the emergencies where they've asked the patients not to report them to their physicians, ones where the patients have gone home themselves, or ones where the patients have cared for themselves in the emergency room.
Okay, so my original question, your company, so you've come up with a way, you've invented, I guess, a new kit, emergency kit, drug kit, right?
That's correct.
Easier, friendly, and what do you call it? You have a name for it.
Well, we call this patient safety in a box.
Okay.
But let me tell you this wasn't invented because I sat around and said, let me think of something to do to help doctors become more knowledgeable in medical emergencies. This was invented because I had a need, and I knew that I had to do something different for myself. And I realized if this occurred with me, if I had a need that I needed to care for, that there must be other people like me. There must be other doctors that have these same needs, because I'm like any other dentist, and if there's 150,000 other dentists that are having these same problems, then I'm just one.
So your company then provides a better emergency kit.
I provide the doctor and staff with an emergency drug kit that will care for the 7 most commonly occurring medical emergencies. As general dentists, we are going to see about 7 medical emergencies in our office.
Okay.
We only need to be prepared to treat about 7 medical emergencies in the office. I'm going to give them the drugs. I'm going to teach them how to use it in a very easy, concise, simple way. I'm going to train them how to use it. I'm going to give them all the tools they need.
So you do like a half-day training, a full-day training with their staff?
Yes. I can give them a half-a-day training. I can give them a full-day training. The half-day training is going to teach them how to recognize and manage the 7 most commonly occurring medical emergencies.
Okay.
The full-day training is absolutely going to be a blast. In the afternoon, oh, you're not going to believe it.
It's fun. The staff likes it. Okay.
I hear it is, and I'm part of it. In the afternoon training, the staff is actually going to go through the scenarios of the 7 most commonly occurring medical emergencies. We go through each of the emergencies. The doctor and the staff reenact the emergencies.
And everybody has a role, you say?
Yes. Here's what's interesting.
Not just the doctor, but the staff.
Here's what's interesting. Number 1 is I've delegated 3 primary roles. So the doctor has a role. Each of the staff members have roles. My training allows the staff to have the responsibilities with as few as 3 responders. I've delegated the roles for each of the responders. All of this is outlined in my training. So we train them in their roles. Not only do we teach it and we reenact it, but I videotape the doctors and the staff in these roles. We set up a YouTube channel for the office, and I send them all the training so they can watch it. They can see where they need to fine tune.
Probably over this.
Oh no, they never laugh. At the end of the training, I'm going to give them all the inventory sheets that they need to maintain their equipment, maintain their supplies, maintain their drug kits. Then they'll also have all their flow sheets for the maintenance of their emergencies.